The country of India is probably the most complex society that we have attempted to work in. It has so many contrasts of rich and poor, of haves and have-nots. The medical system in India is all over the place. When you are in India and witness the deprivation, it is shocking. We go into medical schools in India where the ceilings are falling down. Often the electricity doesn't work. But oddly, India, like every place in the world where we have been, has enough technology that they have cell phones. Every doctor in India has a cell phone. India has one of the highest infant mortality rates in the world. Much of the problem is lack of access to information. There is so much preventable mortality, particularly in the under 5-year age group, and especially in the under 1-year age group. So our goals here are certainly to prevent mortality, because often the kinds of conditions that are easily treated are ones that if you treat them immediately, you have a fully functional, normal child again. To the uninitiated person walking into a pediatric ward in a public hospital in India, it's ghastly. People lying in the hallways, sharing of all kinds of medical equipment, individuals with infectious diseases that are known to be extremely infectious. The doctors are overwhelmed with work, and they, I think, do an incredible job for the few resources they have. And they are all the time scrambling to find information about what to do about these cases. But with a little bit of help, they could do so much more. We come to serve children that are impoverished. So we go in and we build on what is there. We have a highly focused goal there. We are trying to give them modern medical information in a way that they can retrieve it instantaneously, that they can use it at the bedside to take care of patients, that they can use it to take home for self-knowledge, and to use for teaching. Because we know when we go into these public facilities that they have so little capacity to do that. We really have a desire to have high impact in the time we have. When we were in India, we did 15 trainings. We trained 750 doctors. And when you really think about the scope of this, it's staggering. Every one of those doctors sees on the average of 5,000 to 10,000 kids in a year. We're providing them with a piece of software that they can access within seconds to help them with decision making. If you do the arithmetic, it's almost unfathomable what we are accomplishing there in terms of potential benefit to care of children. We are giving them access to the most current scientific knowledge in the world, and we follow up with them. We look at how they use the software. They send us back evaluations of how they're using it in the clinical settings, and they use it all the time. And many of the doctors are using it as their primary methodology for teaching other doctors how to practice medicine. The hospitals and the medical schools cooperated wonderfully with us. They got the students there, they got the doctors there, they got the attendings, the professors there, and we dealt at the very beginning with the leadership. We got their buy-in, and this, I think, was really key for us. That this was an incredibly important thing that we were doing, that it was going to make a big difference in the care of patients there and in their personal learning.
People have already started using it from day one. So that, I think, is the best feedback, and that's because it's comprehensive and yet concise. It gives you everything, and you can use it on the bedside, which I think is where you need it the most.
Evidence-based information can save lives. There's evidence about that, so Dynamite Plus bridges that gap and it brings evidence very close. I can't see evidence being more close to a practicing doctor than what Dynamite Plus has done.
Because of speed of access, supposing I'm not very sure, I know the disease, but I don't know what to do about it. And at that time, if something is there in my hand and I open it and I know, okay, this is the right step, then definitely it will prevent morbidity and mortality.
95% of what we receive goes directly to programs, and this is really extraordinary. Despite that we have a huge amount of free professional assistance, despite the fact that we get $1 million of one of the world's finest and most current softwares for free, we still have a huge expense of actually getting to these sites and conducting these missions. We have a desire to do way more. We have seen the transformational effect of what we do, and we see the enthusiasm of the doctors about what we do. But we are limited, of course, by money, by the lack of adequate staff to staff more sites. But there's always more things to do that we can't do. And this is the frustrating part of what we see, that we can provide an incredible opportunity for these doctors to access knowledge, but we can't do enough of it. For us, we are totally dependent on our donor community who's been incredibly loyal to us, but we need more, we need better resources, we need more staff, and when we have that, we can just continue to expand the project that we're doing. And I think if we ever sat down for 1 minute and calculated the number of lives we have saved, the number of doctors whose careers we have improved, the number of disabilities that we have prevented by earlier intervention, it would be staggering.